Friends, very good afternoon to all of you. And I know it's very difficult to keep yourself awake and alert after a good sumptuous lunch perhaps. Anyway, we'll start with this session, which is a very interesting session indeed. Technology within technology. Medical science in itself is such a highly technical department. That's very until unless you've been worked in the department, you've been very closely associated with the systems of the department. Many a times you don't even understand how it finally works out. There are so many programs, so many ifs and buts, and so many complexities within each scheme that we devise, that finding a technological solution to it itself becomes a very daunting task. We have in NRHM, in Health and Family Welfare Department, I will not just say NRHM is within the department. There are so many beneficiaries and so many service providers that you have to monitor all of them at the same time, starting from, let's say, from village. If we have Village Health and Nutrition Day, then whether on that day how many ANCs, antenatal checkups, actually took place, what was done, was there a quality in the antenatal checkups, the data being entered and then web-enabled, real-time analysis. Then similarly, if you have Gaon Kalyan Samitis, how are they functioning, PHCs, CHCs, have the equipments reached, have drugs reached, are they being utilized properly, is the first in, first out principle being maintained, is there an expiry, how do you take care of all these things. And then obviously management challenges of managing many crises, etc. And so there are so many challenges and so many opportunities within the challenges. Since there are challenges, I think at this particular moment of time, if you compare all the departments, very few departments have so many opportunities for ICT applications, IT applications, other than Health and Family Welfare Department. Health and Family Welfare Department, really, that sector, health sector, has lots of challenges, and the challenge today is that all those who have really understood this system should keep on working, because there are many a times we do feel that now going ahead is becoming tough, but really those who have been doing these things, I definitely want them all to keep on working on their missions and see that health actually finally reaches all, because technology is the key to healthcare services. That is the key, and ICT is definitely the key. If we do not develop our systems IT enabled, if they are not IT enabled, then perhaps many things will not just take place. Having given that background for this session, I'll just present one such complex system in health department, which is the blood banks. God wanting, I will wish that none of you go to that blood bank ever, or you don't have that opportunity, be it for yourself or relatives or anybody, to go to that blood bank. But having said that, it is something that we can't escape. Every day there are so many things happening around which require those situations which require blood transfusion. And therefore, just to take you through, because many of you may not be knowing what a blood bank is like, I'll just take you through the system itself. First of all, why do we need blood? Why do we need blood is very clearly pointed out. Most of you are intelligent enough. I'll not go through this slide. The reasons are known, and these are very, very important reasons, starting from hemorrhages to accidents to anemia to dengue. Dengue is an emerging disease where you require blood components, platelets. Then patients suffering from severe hemorrhages, etc., and so many diseases that we come across every day. Now, the issue is that the blood is not manufactured anywhere. It's just manufactured in our bodies, and that it has its own shelf of life, which is being debated. Even today I was going through an article Earlier the shelf life was defined as 6 weeks, but now there has been some research in London, somebody has conducted that research, says no, it should be only 3 weeks. So, which means people are working towards quality of blood transfusion. That quality blood is available, quality blood products are available, because once it is given to a person, he should not, the blood transfusion itself should not become a problem for him. He is already in a deep problem, that itself should not become. But the bigger challenge than the quality itself, that quality, how you maintain quality and how do you address that quality issues through ICT, that I'll let you know through my presentation. But a bigger problem is that many times you don't even know that this blood is available or not available in a blood bank for citizens, common citizens who do not understand the niceties of the entire system. They want blood immediately. And that is where those who have read economics, that is where the scarcity is sometimes created artificially. Perhaps because of self-interest, perhaps some people have a rent-seeking behavior in the system. They create an artificial scarcity. So how do you get away from this? That you can beat only through an IT solution. This is what the aim of this entire presentation is. So, having said that, from whom it is safe to take blood, that screening is done. You collect it sometimes in, process it, test it. There are 5 mandatory tests that you have to carry it out. It is not safe at all. How do you find out whether that 5 mandatory tests, checking all the records, is just not possible. Sometimes you can just enter it has been done and you put it in the fridge and it's gone. And next it is transferred to somebody and you never know that you have to do this cross matching. Then you obviously, if it is compatible, then you. The seropositivity rate is also going. So whether the quality blood transfusion is being done, quality blood is being collected, becomes very important. Now, blood transfusion services prior to e-blood banking, most of this I have already covered. The constraints and challenges are these. Public has no easy access, I told you. Sometimes artificial scarcity is also created. There are manual donor screening, as I told you earlier. It's done manually. The levels of operation are there at multiple sites, and therefore sometimes equipment failure could be there due to variation in laboratory procedures. How do you maintain that SOP? For every equipment there is a SOP. Whether that is being calibrated every now and then at a regular interval, sometimes you cannot know. Then there are issues related to testing kits and reagents. There are manual errors that could actually creep in. There are inaccuracies in the recording or transcription. Naturally, humanly, it's not possible always to keep track of all these things. So e-blood bank, with this background of the system and the problems which were there in the manual system, we wanted to minimize all these gaps through IT automation, complete IT automation, which starts from the donor to availability of the blood to the common citizens. The additional inputs also were then incorporated in the system to improve the quality and to standardize blood banking services. We saw it as an opportunity for doing many things which we were unable to do. To standardize blood banking services, to have SOPs, clear SOPs, to also link it with licenses. Licensing of blood banks is also very essential. At regular intervals they are checked, and the blood banks know that this is my date of renewal, but they are unable to get into the system. That is a different set of system where you get your license and then you apply. You do not know where my license is, when will it come, when will they come for joint inspection, etc. This was an opportunity where we could also link it with the licensing system. And then web-based camp management also. And each equipment, as I said, working status also we can find out. The e-blood bank life cycle I have already told you, I need not go through it again. So these were the enhanced modules through e-blood bank. These were the envisaged modules through e-blood bank. To consumable inventory management system is something that we wanted to do. We wanted to also have an asset management system We wanted to have a bio-waste management system, a blood supply chain management, employee information management system, and a blood bank license management system, the last one that I told you. Integrate all of them in e-blood bank. That's e-blood bank, having several systems, subsystems in it. So these are the 4 advantages from the, at some point I mentioned all of these. Process automation, the entire process gets automated. Complete automation. Quality and standards are maintained. Management of the entire system, of all records of the human resources, and provide citizen-centric services also. So we now have a dashboard for blood bank officers, tested, untested, buffer stock. These are the entire process automation allows that. And I'll just show you which is the blood group number reserved. Everywhere, whole blood or whole buffer level, stock level, everything you will know. The single source entry for documentation, easy tracking of patients. These are all there in the process automation on the dashboard of the blood bank officer. The quality and standards are also maintained. There is an optimal utilization of the blood units before expiry, as I told you earlier. It has its own life cycle. So you have to use it before that. If you do not use it before that, then it is a wasted blood and it has to be destroyed, which you sometimes read in newspapers also, at so and so blood bank, so many units were destroyed and all. It is because we do not optimally utilize it. We do not know that it is going to expire and that there is a blood bank where this same blood group, these numbers are required, but it doesn't have. Can you transfer it to that blood bank? So that that blood bank which does not have it will utilize it within that given period of time, and you will not be compelled to destroy it later on. This is something that we wanted to do. Then donor screening using unique identification codes through biometry. Donor deferrals at different stages. Ensure 5 mandatory tests, as I was mentioning earlier. And tracking of validation of kits and reagents as per their SOP. Asking, how much do you have? Then he will say, I think I just had one and somebody took it away, and so, sir, how do you, I have to get it? Okay, then I can find out. There could be 2-3 left, but it's difficult. That must be in buffer stock. So somehow when it comes, then you know the rent seeking is taking place. So this he cannot now, right now can do. Any of you who want to try any of these 3 systems right now, which is one is IVRS. If you dial 1-800-345-777-47, which is a toll-free number, you will be led through that voice call to give your STD code of the district where you want to know this blood group, and finally give a blood group code which they will guide you through. This is IVRS system. The second one is easily, you can right now do it easily. Through SMS. If you don't have a BSNL mobile, you can do it through 56767. If you have a BSNL, then you'll do it through 54323. So you first type all in caps ODBB, give a space, then the first 3 characters of the district where you want it, and then give the space, the group that you want, A, B or O, whatever, whichever you want, and then again give a space. And depending upon whether that is positive or negative, you will write E or N. Immediately it will give you the number of blood group, the blood units which are available in all the blood banks in that district. So if I would say Sambalpur, it will give you Kuchinda, Sambalpur DHH, everything it will give you. So if somebody would like to test it? Any questions on this? Done, but the tests are done later. But if you come for a replacement, maybe tests and all, it takes time. But there are different other methods also which you can do a preliminary screening through rapid test. Rapid test is something that we are not allowing now because that is not non-specific. But the specific test, if you take, it will really take time.
So is the donor being, so if there is a problem with the blood sample, so if the donor being said that reciprocated that message and all?
Yes, that's what deferral is.
Okay.
I mentioned about donor deferrals. So when the donor has given his blood and the 500 tests are done and it is found that that blood cannot be accepted, it is told to him that your blood is deferred. It's not accepted. Screening properly the donor. That is what we want to avoid through this automation of giving smart. That maybe you can discuss. That's not related to e-blood. That is separately done.
Any other question?
On e-blood bank.
E-blood bank.
The IVR system is not working.
It is not working.
I have tried 4 times.
Will somebody come and do it? Guru? SMS भी नहीं करो नहीं. IVR is become which district did you?
People, this IVR system is more convenient.
Yes, I will. 777 अपना message करना. मैं message नहीं call करना. It's not message, call करना. It will guide you through everything. It will tell you.
Sir, I have a question. Mr. has second largest population of tribal matters to all. So what is your take on them, how they are going to be benefited by this? Because they are diverse people and we have to do that as per their diversity. So we have to say anything on that.
See, insofar as these areas where tribal populations are more, anemia cases are more, even severe anemia, we get pregnant mothers who are severely anemic at the time of delivery. These are the cases, these are the patients who require blood very frequently, and with this citizen-centric services, they need not actually wait for somebody to tell them whether it is available or not. Second thing is, we have a program